and then I have a patient who comes to me and mentions that they feel sad when they breastfeed. So there are a number of reasons why that can happen, but there actually is a phenomenon called DMER, or Dysphoric Milk Ejection Reflex, which is a situation when our hormones change in a more extreme way than they should. So what's specifically happening is that the hormone dopamine decreases at the time of a letdown of milk, and that causes negative emotions to happen, often sadness. I've heard people say that they feel like a feeling of doom. Some people feel nauseous, and it's not controllable, really. It happens because of this chemical change in our brain. And people start to feel it usually right before a letdown, and then it lasts through the letdown and a bit beyond. And it can happen with multiple letdowns or only the first letdown. Some people feel it with only pumping and not with nursing, or vice versa. The good news is, not crazy. This is a real thing that does occur to some people. Unfortunately, it can really be disconcerting, and when you anticipate this very negative feeling every time you feed your baby, that can make you not want to nurse anymore, understandably so. So depending on how severe it is, there are different things that can help. So one is, I've had moms that once they tell me what's going on and I explain to them that it sounds like DMER, they just say, "Oh my gosh, Dr. Rubin, I'm not crazy. I thought it was crazy." I hate using the word crazy, and I've been using it a lot here, but I think you get what I mean, because in this situation, people really do think that they have some sort of mental health problem, because this just doesn't make sense why they would be feeling this way. And they're just relieved to know that this is actually a thing. It's a phenomenon. It is a medical issue that is happening. And the good news is that it does usually get better on its own over time. Many people find that it resolves by about 3 or 4 months after they start lactating. Sometimes it does take longer, and sometimes it does not go away completely. But for many, it does. And again, so for mild symptoms, sometimes people just feel better knowing that nothing's really wrong and that it is going to get better. Some people have, that doesn't really help them a lot, just knowing that. And there are some things that you can do, just general health things, just taking care of yourself better, staying hydrated, exercising, getting good sleep. Overall helps all of our hormones that play into mental health, and might help to balance things out and make them a little bit less extreme so that the symptoms aren't as severe. Some people have told me that they find that watching a funny TV show or playing a very mindless game on their phone or something like that can really be helpful if they plan to do that every time that they are nursing. It's just a good enough distraction and gives them enough of the good hormones to balance it out. There are medications that can help. So in severe situations, or if you are just really affected by it and it doesn't seem to be getting better, then it absolutely is worth seeking out a professional, a breastfeeding medicine professional, or if your personal primary care doctor or OB-GYN is familiar with this, then they may be able to help prescribe something that will make this more manageable. So DMER, Dysphoric Milk Ejection Reflex, it is a thing, and it's good to just know about, so that, when you hear this from other people, you kind of can help reassure them, well, this is actually a thing. You should talk to your doctor about it. Now, that being said, sometimes people feel sad or upset when they need to nurse for other reasons that may run a little bit deeper, maybe I shouldn't say it that way, but if you have pain when you breastfeed, you may really dread breastfeeding, or just feeling while you feel the pain, it's a negative feeling and it can affect your emotions at that time. There could be other things going on in your life or in your personal mental health situation that leads to certain emotions around breastfeeding. So regardless of why it's happening, if these things are happening, you need help in some way. If it's a deeper mental health problem, then you need some help from a therapist or a perinatal psychiatrist. And if it's DMER, then again, just reaching out and making sure that you've got the right diagnosis in your mind and know the ways to treat it yourself and when to seek help is really important. So hopefully this has been helpful, and I'll see you next time.